Hello, I'm Dr. Naim, and welcome to my channel. Today, we're tackling vitamin K deficiency, a condition that can cause serious bleeding especially in newborns, and affects people all over the world. I'll cover its types, causes, symptoms, diagnosis, treatments, home remedies, who's most affected, and how age plays a role. Let's dive in. What is vitamin K deficiency? Vitamin K deficiency occurs when the body lacks enough vitamin K, a fat-soluble vitamin vital for blood clotting and bone strength. It's a major issue in newborns, with 30% at risk of bleeding disorders without supplementation. Routine vitamin K deficiency injections for infants prevent most cases, but deficiency can still occur in malabsorption disorders or those with specific medical conditions. Early detection is crucial to avoid complications like hemorrhage. Types of vitamin K deficiency: primary deficiency due to inadequate dietary intake of vitamin K-rich foods, for example, leafy greens, broccoli. Secondary deficiency, caused by malabsorption, for example, celiac disease, cholestasis, or reduced gut bacteria production, for example, from antibiotics. Neonatal deficiency, common in newborns due to low placental transfer and limited gut bacteria. Acquired deficiency, linked to medications, for example, warfarin, or liver disease impairing clotting factor production. Anatomy and physiology. Vitamin K supports critical systems. Anatomy, stored in the liver, where it activates clotting factors. Affects the blood vessels, for hemostasis, and bones, for mineralization. Physiology, vitamin K converts clotting factors, 2, 7, 9, 10, and proteins CS into active forms by carboxylation, enabling blood clot formation. It activates osteocalcin in bones, promoting calcium binding. Deficiency impairs coagulation, leading to bleeding, and weakens bones, increasing fracture risk. Causes of vitamin K deficiency arise from dietary and medical factors. Dietary: low intake of vitamin K1, spinach, kale, or K2, natto, cheese, staple diets, or restrictive diets. Poverty limits access to diverse foods in Pakistan. Medical malabsorption disorders, for example, Crohn's, biliary atresia, prolonged antibiotic use, and reducing gut bacteria. Liver disease or warfarin therapy impairs vitamin K function. Neonatal, low vitamin K stores in breastfed infants. Breast milk is low in vitamin K. Cultural factors, limited breastfeeding and supplementation gaps. Vegan diets or noncompliance with newborn injections. Age-specific causes: newborns, high risk without prophylaxis, adults with malabsorption or medications. Elderly, chronic illness, or poor diet. Signs and symptoms depend on severity. Early symptoms: easy bruising or prolonged bleeding from cuts. Nosebleeds or gum bleeding. Severe symptoms: hemorrhagic disease of the newborn, HGN, bleeding in the brain, gut, or umbilical cord. Gastrointestinal or intracranial hemorrhage in adults. Bone fragility, long-term deficiency. Age variations: newborns, HGN is life-threatening. Adults with bleeding tendencies or fractures. Elderly, exacerbated by comorbidities. Any unexplained bleeding requires urgent medical evaluation. Diagnosis uses clinical and lab methods. Clinical assessment: history of bleeding, diet, medications, or malabsorption. Physical exam for bruises, petechiae, or bleeding sites. Laboratory tests: prothrombin time, PT, INR, prolonged in deficiency, normalizes with vitamin serum. Vitamin K, rarely measured, but low levels confirm deficiency. Response test: bleeding improves after vitamin K administration. Challenges: limited lab access and clinical diagnosis are common in Europe. Routine newborn screening and INR testing ensure early detection. Action: suspected deficiency, especially in infants, needs immediate attention. Most affected gender. Both genders are affected, but females may face slightly higher risks. Females' pregnancy increases vitamin K needs. Breastfeeding mothers risk deficient milk. Cultural dietary restrictions limit intake. Males are affected by poor diets or medical conditions. UK/Pakistan, pregnant women and newborns of both genders are prioritized for supplementation. Impact across age groups. Vitamin K deficiency affects all ages. Newborns high risk of HGN in Pakistan, 1 to 2% without prophylaxis, which can countries prevented with injections. Young adults, 18 to 35, rare, linked to malabsorption or vegan diets. Elderly, greater than 60, increased risk from chronic illness or medications. Global data. WHO highlights that neonatal deficiency in low-resource settings in Europe's cases are minimal due to prophylaxis treatments. Standard treatments correct the deficiency. Medical treatment supplementation. Newborns vitamin K1, phytonadione 1 mg IM at birth. Adults, oral/intravenous vitamin K, 5 to 10 mg, for bleeding or malabsorption. Warfarin reversal requires higher doses. Underlying conditions. Treat malabsorption of bile salts for cholestasis or stop offending drugs. Supportive care. Nutritional counseling for vitamin K-rich foods. In Pakistan, community health programs promote newborn prophylaxis. Other developing countries use fortified foods. Home remedies. These remedies boost vitamin K intake. Spinach/sog, cook in curries, 1 cup daily, for vitamin K1, Desi staple. Broccoli, steam or stir-fry, ½ cup daily, for K1. Kale, add to salads or smoothies. Eggs, 1 to 2 daily for K2. Yogurt, fermented for K2, 1 bowl daily. Green tea, supports overall health, 1 cup daily. Caution: consult a doctor before supplements, especially with warfarin or pregnancy. Vitamin K deficiency can cause serious bleeding, but with early diagnosis, supplementation, and home remedies like sog and eggs, it's preventable. If you found this helpful, like, subscribe, and share for more insights on MedWise by Dr. Naim. Comment below what's your favorite vitamin K food. Stay healthy, and I'll see you next time.